And as we were talking, I was looking at my slides and I saw October 2020, that's a fun date. So just something unnecessary to be thankful for. Just a fun date. So HIV activist. So that was my identity. I recognized and I worked with people living with, I should say living and dying with HIV, because at that time there was no medication for HIV where I was working. And the reason I carry the HIV with me, even though I'm not directly doing HIV work anymore, is also the reason why the 3 ribbons are 3 different colors. The first ribbon is the concentrated red, where there's acute HIV infection, people are dying. And then it gets bigger and bigger, but it also is almost invisible. And that's how I recognize my HIV activism in the community. HIV is completely present and active, yet it is invisible. And same thing, HIV and any kind of infectious disease that is stigmatizing, potentially stigmatizing, is continuing to be invisible. And so when I think about my work with the refugee community, I also think about my training as an HIV activist. And so this is something that I do talk about later. So let me see if my mouse will work with me. Yes. I want to start by invoking Ubuntu, which is I am, because we are. I cannot do this work without my colleagues and without the support of all of you, as well as the community members that I work with. So I am because we are, and that has been something that helps me move forward with the kind of work that I do. So when I think of refugee immigrant health across cultures, again, as I said earlier, I am a proud immigrant, and some of the experiences that I have had, I can see that in other immigrant and refugees' lives, and I am acutely aware I am a privileged immigrant. I'm acutely aware I came here completely at will. I came here because I wanted to. And even with that, the kind of experiences I've had, and when I compare that with the kind of experiences other immigrants and refugees have had, it's just astonishing how much culture and how much politics play a role. And I'll talk a little bit about all of those, but just wanted to say who is affected with everything that's going on when we think about women's health or access to healthcare or poverty or challenges of patriarchy, who is affected. And even when I'm talking about my refugee families, it is the women who are left at home to hold it together. It is the women who are taking care of the children, trying to explain what happened, why their father cannot come from Yemen or Syria or wherever they are stuck for the last 2.5 years or 3 years or more. And why is it that she has to figure out who can go to school and why she has to stay at home to take care of everything. So again, coming back to the question, who is affected, is certainly something that allows me to recognize the disparity in this all. So I want to share the Refugee and Educators Aligning for Communities' Health as a concept. And I'll take the example of the English as a second language as just one of the channels. So if you see, it's broken down into 5 pieces. So refugees are newly arrived. We may or may not know about their prior education. Some of them may have gone through school, some probably not. We may or may not know history of health, mental health. We may not know anything about their experience of acute trauma. However, being uprooted from your place of dwelling itself is traumatic enough. in addition to any war or displacement related trauma. However, when I, as a volunteer, see a refugee or an immigrant coming into my ESL classroom or in my community gathering place, I have absolutely no way of knowing anything of that. So as educators, so let's take ESL instructors or as community service providers, not necessarily trauma-informed, trauma-sensitive, or trauma-trained. That is not necessarily part of the training. However, my colleague Gina is trying to change that. And she reached out to me to actually develop some kind of a training for her ESL teachers or for students who are going to be ESL teachers. And she's requested my class, which is offered through GWSS, to actually develop a curriculum that will be helpful for educators to recognize the trauma sensitivity is important. However, in everyday life of refugees and immigrants who have encountered social service delivery people, most of social service delivery, human service delivery people are not necessarily trauma informed. So taking it back to the classroom. So as an ESL instructor, you would see certain behavioral traits that are more like non-compliance. So when you are asked something, you don't respond, the student doesn't respond, the refugee student doesn't respond, or the refugee student will not make eye contact, or the refugee student will try to pretend they're not listening or they're not paying attention to you. And what may seem like behavioral or academic non-compliance, when you look at it from a different lens and have a much more nuanced understanding of what that person may have gone through, it could actually be just a response to, I really don't want to be seen. I can hide under the table. There's too many people around me. It's suffocating me. And unfortunately, the classroom is not that place where these things are even discussed, let alone addressed. And so when we think about aligning by developing a partnership, we do want to develop that partnership with refugee and immigrant students or people who have been here for some time. This particular idea is within the ESL classroom with higher level of refugee students who could be seen as peer educators or who could be working with us as peer educators. And then developing trauma first aid. I'm very glad Dr. Rumiana Kudeva is here in audience. The trauma first aid curriculum is something that we talked about and we continue to talk about as something that everybody should know. It doesn't require superior training, licensure. It's something everybody should know, especially if you're working with a potentially not even potentially, especially if you're working with a refugee immigrant person, anybody who has had to go through leaving their country because it is no longer safe to be at home needs to know how to work with trauma first aid. And then community, so refugee immigrant integration, trauma awareness, as well as especially social service agencies need to have a space for safe advocacy. And that is something, Spokane is small enough for us to be able to achieve that. And health is beyond just physical health, emotional health, well-being, addressing isolation. Isolation can be extreme and leading to ill health. And I see that with a lot of examples of people who are isolated because of who they are, because of their immigration status, because of how they look, because of what they speak, because of how they dress. And so part of coping is just don't be seen. And so isolate some more. So this is just an effort. This is looking at the linkages of where the newly arrived refugee person's experience actually can be supported by having better partnerships. So Dr. Beth Halaas at the School of Social Work. And I developed Refugee Community Partnership Model, which drew from best practices. And essentially, if you put the refugee and immigrant person in the center, it really is looking at commitment to good practice, emphasizing competent practice and understanding the community. And I'm going to break this down quickly and probably walk through just each of those components, but walk through with some examples. So when we think of improving access, effective communication, high quality service provision, strong partnership working, so commitment to good practice. So just an example that comes to mind. So in Spokane, we have the Gateway Agency, which is World Relief, which is the only refugee settlement agency, resettlement agency that is federally funded here. And so they would bring people in and would place in different employment places, such as Davenport Hotel, the Grand Hotel, and other places. When I think of commitment to good practice, so, and I'm not necessarily calling out the Gateway Agency, they do a lot of work. However, it needs to be integrated in a manner that there is feedback. One of my students was stuck in an elevator in Davenport Hotel all night because he did not know how to operate the elevator. And the reason he was stuck is nobody showed him how to operate an elevator. There was just this expectation that, oh, you're working at a hotel, you know all these modern gadgets, you just know how to do this. So he went into, he was working at a night shift. He was carrying something and he was told, take the elevator and go wherever and locate, how you want to go there. And so he got inside the elevator and then he closed the door and he pressed the button and something. And whether it was not working, I don't know what happened. He was stuck inside the elevator all night. And so when we think of commitment to good practice, my recommendation will be, or my advocacy will be, great, Gateway Agency, work with the employer and the person you're placing so that everybody's on the same page, that you know that, okay, I'm going to have to take the elevator. Employer, give your employees, your new immigrant employees, a rundown of what to do, where to go, what happens if I'm stuck, where can I get help? Just close that loop. Don't leave people hanging. The second aspect, emphasis on competency. Again, developing strong multi-agency partnerships. Not enough to say, go to DSHS, get your food stamp, go somewhere else, get your children in school. Go to Winco, this is where you get your groceries. Go to the STA, get your bus pass. It needs to be a lot more collaborative. You cannot expect somebody who comes in from a different country, speaking different language, looks different, feels different, is made to feel different to automatically know all those things. So one size does not fit all. You want to also recognize diverse range of refugees. So one example that comes to mind, again, emphasis on competency, the school bus that goes and ferries students to schools. This is pre-COVID time. One of my, in the ESL classroom, one of the students, an Afghan girl, 14-year-old, she was not in school. She was coming to the night classes. So we tried very hard to get her to school. The school was ready to take her in. She was a brilliant student. The problem was the school bus that will take her to school. She will not be allowed to ride the bus without a chaperone. And the school will not allow anybody other than the student to ride the bus. And so there was no way that the family and the school could get on the same page on how to bring the student to school without a chaperone, or with a chaperone that is allowed and acceptable. And then understanding of community. Of course, context-specific information is needed, and locating community needs assessment is huge in this. Assessing community capacity structure, these are really, really important. And interestingly, people familiar with community needs who are not necessarily tied to an agency such as DSHS or the Gateway Agency often are better storytellers, I would say. They're often much more in touch with the refugee and immigrant family than we would expect the regular agencies that are working with the refugee person to have that information. So again, understanding of community doesn't mean only work with the refugee and immigrant, but also the other people that are working with them. So I go to my next slide, which is from United States, SAMHSA's Principles of Trauma-Informed Approach. And I look at it and I look at it again, thinking about my refugee immigrant community, where each of these pieces of safety, trustworthiness, empowerment, collaboration, peer support, history, gender and culture, which is a given, which is the setting of the context, but safety, trustworthiness, they've lost it all. They've lost each one of these to come to this country. That's their first step. They've come here because they're not safe. They come here because they do not trust their neighbors. They come here because they are disempowered. They've come here because there is no ability to collaborate. They are here because of lack of peer support. And so when I look at 6 principles, we are starting our work with the refugee immigrant population minus the first 5 pieces. We have the history, gender, and culture to work with, and that's what we work on. So this is, for me, brings, start where your client is. It just brings it to light so much more. So when I think of SAMHSA's different approaches that we're supposed to be taking into consideration, so I want to recognize how about refugee-specific interventions. So how do we as social service or human service delivery people, human services people, how do we identify the traumatic experiences, and how do we work with these experiences that people have had, in addition to loss and death of loved ones or detention. And so just a little context, per US law, refugees are required to enroll in ESL classes within 10 days. Irrespective of all the things that we saw, all the traumatic experiences that we saw here, refugees are expected to be in class 10 days of entry into the United States, no matter what. If you're not there, simple, you don't get your benefits. It's by law, by the Refugee Act. And so I do want to recognize that the pathways are not uniform, and the service provider, ESL teacher, mental health person, school person, their children's educator may not be trauma trained. And so the opportunities for re-traumatizing, triggering, and therefore just reinforcing an unsafe environment is huge. So bringing it all together in a community integration model, so entry point can be the resettlement agency. Do a warm handoff, whoever you're working with, warm handoff to a trauma-trained professional or a human service trained student at community-based agencies. Just because an agency is working with housing doesn't mean that agency will know how to work with a refugee person who has had different kinds of experiences. So have a warm handoff to somebody who knows context, culture, and is committed to welcome this person. Collaborate with people and community partners who are informed and involved. Continue to monitor, provide support, not only ESL teachers, but whoever is the community service provider. And then the exit point is really transition to college, employment, community college, or any kind of integration. For the ESL classroom, it's easy because they have very structured level 1 through 6. Somebody in level 6 of ESL is expected to go and join college and then continue to go on to transitioning to community integration. And then, of course, make sure that whichever way this model is utilized, there is formative as well as impact evaluation. Refugees are us. So whichever way we work, let's practice collaborative opportunities at individual, group, community levels. Interdisciplinary, inter-university collaborations. Gonzaga is doing something, Eastern is doing something, within Eastern, social work is doing something, some other, Gina's department is trying to do something. So there's a lot of people are doing a lot of things. We all want to do the same thing, so let us collaborate. Certainly address and uphold diversity and social inclusion, and use language that supports reconciliation and negotiation of shared existence. Refugees are not here because they want to be. Refugees do not even have the choice of coming to the United States. That is determined by the UNHCR, where a person will go. I have worked with refugee families where the mother and one child is in Spokane, father and one child is in Australia. So it's how the UNHCR has decided to place the family. So refugees do not necessarily opt in to come to the United States. And so in conclusion, we are still looking at the Sustainable Development Goals and working with refugees and immigrants families. It's just a reminder how much work is yet to be done. And so it's just a very little effort that I'm trying to do with the refugee immigrant community in Spokane. I was very fortunate to have a grant that is through a community-based agency, and that, you know, the fortunate part is that we got the grant. The unfortunate part is we do not have enough community collaboration to really take it to the level where it needs to be. So right now I'm in the process of getting another grant that will allow me to work with community service providers and do a community needs assessment in the form of, really, as an immigrant, I am tired of hearing what I need to do differently to fit in to the US landscape. And so I want to posit the question, well, what do you as a community-based agency need to do to welcome the refugee? So I am going to stop sharing and take questions. Okay, over to you.
So thanks everyone for listening. Now I wonder if we can do a quick group photograph at some point during this time before everyone logs off, but feel free to either unmute yourselves and ask the question out loud, or you can type the questions in the chat and I'll read them, or Bipasha, if you'd like to, you can read them. Feel free to.
So if somebody can read, as I said, I have 3 screens and my mouse is not cooperating.
Yeah, I'll read them. I'll read them out loud to you. I'm going to start my video again too.
Gina, you made it.
Yeah, or folks can unmute themselves and ask questions.
I saw Rumiana made a comment that the refugee doesn't need to be thankful for. And that is something that I'm trying to challenge, because when I work with community-based agencies, I do get that sense that, oh, we are offering this service, people should be thankful. I'm like, no, they are here, not by choice, B, they're not doing you a favor by being here. And you are not doing them a favor by serving them. So you need to absolutely not have this, oh, you should be thankful of what you're getting. No, And that's, again, as an immigrant, I have experienced some of that, but, I'm a privileged immigrant, and my experience, I am sassy enough to just talk back saying, are you sure this is what you wanted to tell me? But not everybody is. And that's where I continue to, hold social services, human services accountable.
And as just to chime in, as a immigrant myself as well, I am a privileged immigrant because I came through the diversity, visa program, but we need to be aware and constantly challenge that narrative of the worthy immigrant or refugee. So if you're not
Right.
worthy, if you're not educated, or if you're not employed or whatever, then you're not visible, so your story is not going to be on the posters, the American dream and bullshit like that. So we need to constantly challenge this because as Bipasha said, we are part of the community. We're here, so we don't need to prove ourselves as worthy of being here because we are already, as part of the community. So I just absolutely love your work and your passion. Thank you.
Thank you. And just so that it's official, Dr. Kudeva is very much part of this work. So it's not my work, it's our work.
So I didn't realize that refugees were sent here. They didn't have a choice on which. Can you talk about that? Can they go to another place and so their families can be together?
Not without a lot of effort. Okay. So UNHCR, United Nations High Commission for Refugees, they are the central and only refugee resettlement agency worldwide. So if either, let's say there's civil unrest in Rwanda, or there's something going on in Indonesia or Thailand or wherever, UNHCR is the refugee. So when we hear of refugee camps, all refugee camps are run by UNHCR. Each and every refugee camp all over the world is run by UNHCR. So UNHCR will then take all the paperwork and figure out, okay, these people are homeless, or they cannot, their homes are not safe for them to go back to, so they need to be rehomed and sent somewhere. So they just, literally draw up a whole list of places and then try to match with which country is willing to take how many, and then try to find out how they can place. So, sometimes it depends on who's working at UNHCR. It could be a lottery. Sometimes it could be, okay, all families go here. Sometimes it could be, okay, this country can, or this place can only take 2. So send 2 here, send 2 somewhere else. So it's really the refugee is the last person who has any say in this matter. And so once they come in, so a lot of, for example, a lot of people who come in, Spokane is a resettlement city. So a lot of refugees who come to the resettlement city find out that we don't have a very vibrant international population like Seattle or Minneapolis or somewhere. So like Somali population, huge resettlement in Minneapolis. Bosnian refugees. St. Louis is the largest Bosnian community outside of Bosnia. And so so people find their tribe, as I said, and then go and find out where they can be. And so once you come in whichever country, inter-country travel is fine. But until and unless the refugee transfers to a full-fledged immigrant, for them then to go to another country just as a refugee, it may not be as easy or timely. It would be another few years.
We have a question and then a response, partial response in the chat. So Heather Robinson asks, with the coronavirus, we have a dire need for more teachers overall, and especially in ESL. Can you imagine any other fields where skills might transfer to help refugees and immigrants? That is, what fields might not see themselves as useful or connected, but very well could help? And then Gina responds, maybe those that have access to our storytelling channels, public television, journalists. What if we really heard the stories of our community?
Yeah, one place where I feel is completely missed opportunities and I don't know how to reach them is healthcare. I just don't know how to reach the healthcare folks to be more refugee friendly and more immigrant friendly. That's definitely so. Heather, if there is any way we can connect to the healthcare folks, the doctors, the nursing staff, even the paraprofessionals, even if they have the ability to reach out to the refugee communities from the refugee immigrant perspective, not the US perspective, so helpful. My refugee families, my immigrant families are terrified of US healthcare system. Absolutely terrified.
Can I chime in? So last month I moved back here from Melbourne, and I lived in the southeastern corridor of Melbourne, where is a big immigrant, refugee resettlement communities live there. Well, entire Melbourne is, but so what I witnessed there, and I was just absolutely amazed by how organized it was, because it was the same thing. Well, we were actually in a literal lockdown, like we could not leave, our homes, but the message wasn't getting to some of the immigrant communities. And what actually the government did, the state government did, was contacted the community leaders. So within the communities, they actually consulted the leaders and asked why people were not getting the messages of, come on, there's a free testing, come over here, there is, resources for you, abilities to support you. Then what they did was some of the challenges was infrastructure, so people couldn't go to get tested. What they did actually, they brought vans with people, buses with people in the neighborhood, with translators, with people from the community who are trusted, to talk to the folks and say, here you go, these are free, resources for you. This is why you go and get tested. This is what you're going to achieve. So the amount of public health, awareness of there's other ways to do this than our Western, way to do medicine. It was just like mind blowing for me, coming from the States.
Wow.
And Maria Reyna uploaded a resource to the chat as well.
Yeah, I just wanted to let everyone know this. Oh,
can't quite hear you.
Yes, I forget. I got to wear this microphone. I apologize. So yeah, my name's Maria, and I wanted to share that we now offer scholarship to, and it is a state funded in Washington State, to youth that were in that are refugee, former foster youth, and our homeless population. So I did put the flyer in there. There is the website to learn more about that. And then I'll put my email in there if you have more questions. But that's fairly new, the past 2 years, that they now allow or have offered this scholarship for refugees. So just wanted to let you know that.
Yeah. And I have to say, COVID-19, especially with the way the public health infrastructure has been set up, it's very scary for the refugee person, because the moment you go door to door and count people and try to census, and COVID kind of happened at the same time. So it was very scary for immigrant as well as refugees. And again, given the experience and given the context of where the immigrant and the refugee person is coming from, hearing messages from the government is hard. And it's difficult to trust the government sent messages. And so this is where we needed the community-based agencies to really partner in ways that restores that trust.
Do we know, Bipasha, how many EWU students are refugees?
I don't.
Wasn't sure if that's something that we keep track of or not.
We do have some refugee students, and not necessarily through the high school. Some of them also come through the foster care system. But again, my experience is only with the BSW, so I do not know any university-wide. So I'm, I wanted to open up, with this idea that I have been trying to get funded for the last year or so. And really flipping the question of, instead of asking the refugee to learn English and get on with the American way of life, to really ask the service delivery system of, what do you need to be refugee friendly? What do you need to be able to work with an immigrant? Because one size does not fit all. And so I'm in the, and I've very fortunate to have the support of City Council to actually, support this work. They said, you figure it out, we will get people together. And so we are trying to, I'm in the process of actually this week, we have meeting with the funding agency to really do a community-based needs assessment of working with, doing it in a community-based participatory research method, to really bring in refugee voices as well as community agency voices, and then do mixed methods work to really hear people's stories of, okay, why wouldn't you get services, or what would you need to go and seek help for something like intimate partner violence. I've had two of my students killed because they did not trust the way to get A, information, B, help. And the agency's response, and I'm not going to take any names of agencies, but their response was, oh, it is so cultural, we do not know how to break through those barriers. I'm like, so at the end of the day, my student is dead in the car with the car set on fire. And so that's that, I don't know. It makes me angry, it makes me upset that people are vulnerable, and our service delivery system, and I am a social worker in the United States, so I take full responsibility for my role in that. We're just sitting, upholding culture as our screen to just stay in our comfortable position and not challenge where it needs to be challenged. This girl was, 24. She should have been alive. And I cannot say, oh, their culture doesn't allow us to, work with them. So, this, some of you will remember this happened not so long ago. She was one of my students. So I cannot tell you how many of these families do not go to see doctors. Just the whole idea of going into a room with another doctor, another person, male, female, whoever, it is terrifying. Just how the way the US medical system is set up, where you go individually and only one person can go. They would much rather not go see a doctor than, if their culture, again, their practice will be okay. Everybody goes and everybody hears the diagnosis and everybody is part of the decision making and everybody is supportive. That's not, how we do it here with HIPAA. So, how do we find that middle ground? I don't necessarily have good answers for this, but these are some very real situations that ultimately stops the person from seeking care.
We have just 1 minute left. I hate to ask for after that reminder of that horrible event that happened, I hate to ask to do a group picture, and I'm going to anyway, unfortunately. We have a photographer, one of our work study students, Frances Mortel, is a photographer and usually comes to our events and takes photographs. And we use those pictures in our annual report and in our social media. And this is how we're doing events now. So if you're comfortable, please turn on your camera and we'll do a group photograph before the event ends. Whoops, don't want to take a picture of the chat.
Well, I also don't want you to take a picture while you're all down and depressed with my last example. So I do
No,
want to
it's-
give you
Yeah.
the better example, which is there are partners in this work. You know, City Council, Kate Burke's office has been fabulous. Better Health Together has been fabulous to support with this work. And they want to help us find a way of doing this. And, you know, I'm unapologetic when I say that, you know, I do not want to make this easy for social service delivery systems. That's not why I'm here. I want the social service delivery system to step up to the plate. It's not about your comfort zone. I'm not here to support your comfort zone. And Better Health Together and Kate Burke's office, I have received tremendous support from them saying, let's do it. So I'm hoping very soon you will hear more about it, of EWU partnering to do something like this.
That's great.
That's a better place to take photographs, Lisa.
Definitely. Thank you. Okay, so I'm going to take the picture in 3, 2, 1. I'll do one more. Thank you for your patience. It's just a screenshot, no high resolution for us anymore. Sorry, Frances. This must be so hard for you. Frances is an amazing photographer too, so we're very lucky to have her. Okay, 3, 2, 1. Okay, thank you all very much. So we will be back for the next Contemporary Issues on November 3rd. And I really just want to thank you, Bipasha, for this such an important talk today. We really appreciate everything you do for, you know, having you involved in gender, women's, and sexuality studies, having you on campus at Eastern, and having you in our community and our region is just such a gift, and your work is so important. So thank you very much. I'll do the Zoom clap. That doesn't come from Zoom. I don't know if folks know the origin of that is from the disability community. So this is, yeah, so we're lucky to get to access that great part of that culture as well. But I see now there are 6 new messages. Okay, folks are saying thank you. And Gina shared a link to the Spokane Regional ESOL Consortium.
Okay.
And we all just want to thank you so much, Bipasha.
Thank you for inviting me and, you know, listening to me for 1 whole hour. Thank you. I will give me a forum. I'll talk about my refugees all the time. Totally. I'll totally co-opt. Thank you. Have a wonderful afternoon. Appreciate it.
Thank you. Thank you.
Bye.
I'll be here if anyone wants to catch up, Ramiana. Do you need to go? Oh, I'm going to stop the recording.